Automatically, most people think when they have pain on like the bottom of their foot, they always think, oh, I have plantar fasciitis. Just like someone saying like, I have low back pain. Oh, it's sciatica.
Hey guys, what's going on? Welcome back. What are we talking about? Feet?
We're going to talk about feet today.
Okay, good. Perfect.
Since everyone's out running.
So a lot of us have been running. This is Will. If you guys don't know Will, he's been with us at Krank for a long time. He's been in the field for many, many years, and he's my physical therapist personally. He's the one that's been taking care of me, especially when I recently tore pretty much the Achilles. That's Jace. That's his son. So you'll hear him in the background.
I hear some screaming in the background.
It's him. He's playing ABC Mouse.
Yeah.
We're eating pizza with mushrooms. Mushrooms. But he helped me through that. Like, I didn't end up needing surgery. Him and then orthopedic Dr.
I call him Dr. B.
He helped us out, and I actually didn't have to do it just by listening to a lot of things and taking a lot of steps back towards it. But, you know, hopefully something that you guys are going through, we can get a little takeaway from today. So thanks for coming out. I appreciate it.
Thanks for having me.
Yeah, man. The biggest question is like plantar fasciitis. My feet hurt. Do they really have plantar fasciitis? You know, it's that type of thing. What can they do at home? What can people do to prevent it? And what should they do if they do have it?
Automatically, most people think when they have pain on like the bottom of their foot, they always think, oh, I have plantar fasciitis. Just like someone saying like, I have low back pain. Oh, it's sciatica. You know, it's just like everyone's just general like throw out term to like, okay, it's definitely plantar fasciitis. Okay, but usually when they come in, when a patient comes in, we actually like reassess everything. And the big thing that we always see is a lack of ankle mobility, lack of dorsiflexion, tight calves. Yeah, so meaning like when the ankle bends up like this, it's basically just like stiff. So there's not a lot of mobility going in the back. So there's a lot of pull going on here, a lot of irritation going on here, and a lot of tightness back there on that back muscle. We also noticed, I was like, with runners, we also pick up a lot of weakness on their hamstrings and glutes. So whenever we put those two together, we always like try to educate them on like power of like the glutes, the absorption of the hamstrings when you're running and everything like that, all mechanics. So when those two guys are weak, you know, you're going to take a lot of emphasis on other muscles, compensations. What's the next joint down there? It's the foot. So it's taking a lot of absorption, a lot of work. So what we usually do is, of course, we work on the foot, try to get that all loose, try to reduce a lot of the inflammation and all the symptoms. Then we start working on mobility and everything like that, loosen up the calves. And then we start also introducing strengthening to the glutes and the hamstrings. And the big thing is also, too, is using the big toe. If you ever noticed, when people squat, when people lunge, any type of movement, the big toe always lifts up. And then a lot of people with flat feet, you know, they always tend to have orthotics in their shoes. You know, we went over that one time, right?
Out there, I prescribe them. You know,
yeah.
They give it to me.
A lot of doctors would be like, "Oh, you have flat feet here. Wear orthotics." But why? Right. But why? And I was asking, why do you have those? They're like, "Oh, because I have flat feet." But why? It's a muscle. Why would you? So you're gonna say like you're gonna put a brace on a knee, right, and just have it supported and be dependent on that? The muscle's still weak. Still gonna get weak and everything. And also too, foot strengthening. You know, how often do people actually do any strengthening to their feet? Right. You know, gripping the floor. You know, working those little intrinsic muscles. You know, they're the first thing that contacts the floor when we stand up or when we, you know, do anything with our legs. So if anything is weak down there, it's going to compensate all the way up to, you know, to the knee, to the hip, to the back, the low back, the whole chain. Yeah. Most people don't even realize it neither. They're like, oh, I didn't know I don't use my big toe. Oh, I didn't know I have a lack of extension on my big toe. Our other big thing too is that with a lack of extension on the big toe, it doesn't get enough. It doesn't activate the glutes, right, walking and stuff like that. So that's another thing that could be causing when people are running. You know, stiffness in those joint areas. A lot of runners, I always notice, they tend to get like shin splints. You know, when they're landing on their forefoot like that, boom, you know, just like that. Here's that shin bone area, then that muscle in the front, boom, it's absorbing. You know, a lot of runners will take a lot of their absorption from there rather than absorbing from the hamstring, the bigger muscle group, basically. You know, that's what we tend to always focus on or add on hamstring strengthening, because those are a lot bigger muscles that the body can absorb. It takes your body to kind of get used to all that stuff, the floor and everything like that.
Absorber, and if it's not going into those bigger muscle groups, it's going to those smaller muscle groups or joints.
Yeah, which are like the smaller muscle groups are like, you know, that's not enough for like to handle like what's it called? Your own body weight. It's like with like the rotator cuff, you know, we're always using the bigger muscles, but we don't even use the smaller muscles. And sometimes it's the vice versa, stuff like that. You know? It's just based on assessment when we see a lot of our patients.
And then actually see, or just don't even see, I think everyone should benefit from strengthening their hamstrings more and strengthening their glutes almost daily.
Yeah, yeah. And it doesn't have to be like lunges, squats. It could be even isolated stuff with just the band, you know, like sideline clamshells, bridges, single leg bridges, stuff like that. Right. Just to really just target those areas.
Right. That's very much what Joe was talking about, because we got into that too. Just like even just having a band available and making a day, like that should be your workout. Just doing like a day of PT stuff, you know, a couple days a week will really help. And just the isolation, you know, just isolation movements of getting the glutes to fire, especially glute med.
Yeah.
Right?
Yeah. Most people don't even realize, like, you know, when I show them clamshells, it's like, ask them, where do you feel this? They'll point to everything else but the glute med.
100%. I could,
you know?
Personal, same way. Like there's my right side, I could feel it. My left side, it just takes a long time for it to actually come on. But once it does, like you actually feel like you have your legs underneath you.
Yeah.
Sometimes you don't feel like you have your legs underneath you. You just feel like my back hurts or my hips are tight. That's all it kind of feels like when you walk, rather than like, oh, shit. It actually feels like to have your feet underneath you. All right, guys. Well, for today, hopefully you got something out of it, especially for you guys or are feeling, you know, some pain in the foot. Even if maybe you should do it to prevent it, knowing that you are a runner, or maybe you have something like this in the past. I'm sure it can reoccur again. So I want to take time to thank Will for coming out today. Thank you, Will. Yeah, man. Anytime you guys have any questions, I'm sure you can message him. He's a part of our group. He's in our Facebook group. He's part of Krank. So, you know, it's good to have a resource like him and Joe to someone to talk to, or at least get some guidance and, you know, help getting out of the things that are bothering us the most. So we'll definitely do it again next week.
Awesome. Yeah, definitely.
The topics we got. All right.
I got time.
All right, man. Yeah, no shit. All right, guys.
Thanks.
See you later.